A 50-year-old male visits your clinic and complains about frequently involuntary movement of hands without any reason. He further explained that he suffers from involuntary eyebrow lift now and then, and he just does not realize it. After long and careful examination, you reached a conclusion that the patient is suffering from Parkinson's disease. What possible remedy did you think of for his treatment? We will cover all of them in this video, so keep watching. But first, let us get you familiar with Parkinson's disease. Parkinson's disease is a disease of the basal ganglia and is characterized by a poverty of movement, rigidity, and tremor. It is progressive and leads to increasing disability unless effective treatment is given. In the early 1960s, analysis of brains of patients dying with Parkinson's disease revealed greatly decreased levels of dopamine in the basal ganglia, including caudate nucleus, Putamen, Globus Pallidus. Parkinson's disease thus became the first disease to be associated with a specific transmitter abnormality in the brain. The main pathology in Parkinson's disease is extensive degeneration of the dopaminergic nigrostriatal tract, but the cause of the degeneration is usually unknown. The cell bodies of this tract are localized in the substantia nigra in the midbrain, and it seems that frank symptoms of Parkinson's disease appear only when more than 80% of these neurons have degenerated. About 1/3 of patients with Parkinson's disease eventually develop dementia. The cause of Parkinson's disease is unknown and no endogenous or environmental neurotoxin has been discovered. However, the possibility that such a chemical exists has been suggested dramatically by the discovery in Californian drug addicts who were trying to make pethidine, that 1-methyl-4-phenyl 1,2,3,6 tetrahydropyridine, MPTP, causes degeneration of the nigrostriatal tract and Parkinson's disease. MPTP acts indirectly via a metabolite, 1-methyl-4-phenylpyridine, or MPP positive, which is formed by the action of MAO-B. It is not certain how MPP positive kills dopaminergic nerve cells, but free radicals generated during its formation by monoamine oxidase-B may poison mitochondria and damage the cell membrane by peroxidation. There is a term known as secondary Parkinsonism. Let us get to know what happens in that situation. Drugs such as the phenylpyridines and haloperidol, whose major pharmacologic action is blockade of dopamine receptors in the brain, may produce Parkinsonian symptoms, also called pseudo-Parkinsonism. These drugs should be used with caution in patients with Parkinson's disease. Antipsychotic drugs usually block dopamine receptors and often produce Parkinson's disease-like syndrome. Now let us specifically discuss all possible remedies of Parkinson's disease ahead.